So filling out the white sheet, this should be filled out before a patient goes up to the front desk to be checked out. When we get the patient's chart, their name, their exam, time, date, and what insurance they have would already be filled out for us. Depending on what type of exam the patient will have, this is what we would select. If the patient is new and has does not have Medicare, we would select this 92004 code. If a patient has Medicare and we spend at least 45 minutes with them, we would do this code, the 99204. If a patient is returning, which means that they've been here within the last 3 years, we would select this one. But if they're Medicare and we spend at least 30 minutes with them, we would select this one. If we told a patient to return in a week or 2 months, we would select this code 92012 as a follow-up code. Our name will go here. Whatever technician is seeing the patient, their name will go here. If a patient is doing contact lenses, we would check either of these two. If it's a basic, that means the patient is just spherical. They're not doing mono or multifocal. We would select the basic. If a contact lens fitting is a specialty, that means the patient has a toric lens. They're doing a multifocal or a monovision. If we take photos, we would select whether it's external or internal, OCT of the disc or OCT of the macula, as well as visual field. If we do a visual field, we would select this one. Pachymetry is an option. If we do pachymetry, we will always bill for that. And if a patient is coming in for post-op cataract surgery, where we are co-managing with another doctor, we would select this, enter in the doctor information and the date that the right eye was done and the left eye was done. If the patient dilates their eyes, we will circle yes that they dilated, mark an X here, and put the time that the patient dilated and circle DFE here. When we return back to the room with the patient, we can go ahead and select done because the patient will be done. If the patient is returning, we will write their exam here. They're returning in a year, they need to return in 6 months, so the front desk will know when to book their next appointment. If the patient needs to return for a visual field, we will write it on this line and circle whether they will be with the tech or the tech and the doctor. Patients who are returning for a visual field, if they're seeing the tech as well as the doctor for the visual field, then they cannot use Medicare. They would have to be Blue Cross Blue Shield or any other insurance. But if they're a Medicare patient, we cannot bill them to see the tech and the doctor that day during the visual field. The front desk will fill out all of this information as far as the pricing and what the patient will be charged.